is a lame duck session. And some people may know what that means, and some people may not wonder what that is, and maybe they're gonna have duck for dinner. Fiscal cliff. Who's gonna understand in the public what the fiscal cliff is? The grand bargain. I can tell you this, there's bargains I want, but that grand bargain I don't want.
Right.
Bowles-Simpson, we don't want that piece of legislation. And Cooper-Lederette, we don't want that either. It continues to hurt the middle class. And another term I'm not used to seeing out in this called sequestration. If we do nothing, something's going to happen. Something severe is going to happen, and a lot of people are going to get hurt. There's going to be a lot of meetings going on behind closed doors, which there's a lot of discussions that are already being had, but they're going to go on behind those closed doors. So I say to them and us, it's time to get to work, and that's what we're here to talk about today. I'm hearing the word compromise now. Coming out of the Congress, they're saying compromise, let's talk. The Senate says compromise, let's talk. The President says compromise, let's talk. Well, Wall Street's also whining too. They think they're not going to pay attention, they're going to get hurt by this whole thing.
They're talking about raising the retirement age. A lot of people don't realize that the retirement age is now 67 for full retirement. You can still retire early at 62, but they're proposing raising early retirement to 65. I'm a construction worker, I'm a retired carpenter. I could not have worked till I was 68 years old in the construction industry. It's very labor intense, very physical and dangerous. I see a lot of my United Mine Worker Union brothers in this room. How do you expect a coal miner to work until he's 68 years old? If you think construction is physical and dangerous, mine working is a hell of a lot more, oh, pardon me, but it's more dangerous and more physical than that. And this problem can be solved, like I say, eliminate the cap, we can take care of that. And there are a lot of ways that we could fix this deficit problem. Another one of them is, eliminate the Buxh Tax Cuts. I don't know how many of you are familiar with what's so-called Robin Hood tax. It's a financial transaction tax on Wall Street. What's proposed is a 0.5% tax. You're talking about $5 on $1,000. $5 on $1,000. And it's projected if we did that, and some countries in Europe have already implemented it, that we could raise another $350 billion a year. That would go a long way to protecting all of our social programs and entitlements. And I guess that's really all I have to say. Thank you.
Now retiree and doing in-home health care.
The job I do now is nothing like what I used to do, but that particular job is much more meaningful to me than anything I've ever done. Doing home health, you go in, you enter into someone's home, that's not your home and you have to respect it. And the unique thing about doing home health is if you don't do it, it doesn't get done. And the person that pays for it is Medicare, Medicaid, the HHR, and SNAP providing food. And if these particular things don't exist for the persons I'm providing that service for, I was told that that would be devastating to those folks that are family members that are responsible for them overseeing them, not financing them, but overseeing them, for them to have to assume that kind of responsibility for them. For instance, I go in the morning on a normal day. She's sitting there waiting on me because for 20 hours, she doesn't see anybody else till I get there. I know when I go in, I'm well received, or she's waiting on me because there's been no one there but me. And the thing that I'm saying, if I don't prepare that meal for her, like the breakfast and the lunch and the dinner, there's no one to come behind me. And if you take that benefit from her through the Medicare, what is she supposed to do? If she's in a wheelchair, She weighs almost 300 and some pounds. She's only able to transfer herself with her upper body from chair to the wheelchair, from the wheelchair to the bed. If she slips, she's on the floor, and we call the city of Charleston's finest, and I call them the firemen, to come and help her, put her back in her seat or put her in a bed. I'm real alarmed over the fact anybody wants to cut benefits to someone that's receiving home health. It's not like they pay us a fortune. Do you understand what I'm saying? But what we do means all there is to them that receive it. So I'm gonna stand with anyone that wants to hold the door, hold the gate, tell the president, tell anybody, we can't afford to cut Social Security. We can't afford to let people like the person I work for do without someone coming in, giving them a bath, preparing the meals for them, do their laundry, and sit there and hold their hand sometimes when they cry. And they do cry just like we do. But sometimes they cry alone. And they cry alone because there's nobody there to hear them. Do you really want to take benefits from someone like that? Do you want to see their Social Security cut when most of them don't get $500 a month?
Head Start has family training, which means we work with parents to help them become better parents. We encourage them to get more schooling and more knowledge to find the resources in their area so that they themselves can pull themselves up out of the poverty that they are in. Head Start offers education to children, such as we're preparing them for school readiness. Now, if you teach a child to love school and they're doing a lot of hands-on in pre-math skills, pre-science skills, they're gonna love this and they're gonna stick with it. And you'll see them be successful throughout school. But cut it, we're gonna lose children. We at we at Appalachian Council Head Start serves 846 children throughout 11 counties. Now that's just Appalachian Council. And there are other programs such as through Monroe County Schools, through the Northern Panhandle, that service children in West Virginia. Some of those children will have to be cut. Can you see yourself looking into the eyes of a child and saying, I'm afraid you can't get a preschool education right now because federal government has cut funds, and they say, you don't need it. So what's gonna happen to them? What happens to the ones that get cut? Coming from low-income families, they can't afford private daycares or private preschools. So they go to school already 2 or 3 steps behind those who are getting what they need. And eventually, by the time they're 12 or 13 years old, they're not showing up at school, they're skipping, and by the time they're 16, they're gone. So the productive citizens that they could be, their chances have been taken away from them. We in West Virginia say no cuts to Head Start.
Amen.
No cuts to Head Start.
Amen.
We want our families to be strong. We want our children to be strong. In Head Start, we provide health services to children. That means making sure they have their physicals. That means making sure they have their dentals. All of their shots are up to date. We do screenings for children, mental health screenings, making sure children have everything they need so that if there is a problem, we can address it at an early age. So by the time they step in a more structured society as the Board of Education schools, they're well on their way. Can you see taking that away from children? Our children are our future leaders. We have to give them what they need if we want them to grow up to be productive children, adults. Our children, our future. Just think about it. What would the future of America be if we don't reach out to our children and over half become illiterate and unproductive? We have to take care of our children and our families. Thank you.
Now I'd ask if Jack Tincher please come up. Jack is retired from U.S. Air Force, but also VA hospital. Yes, sir. Thank you.
We're getting ready to enter a very dangerous period of time right now as far as working people goes, and as far as veterans go. this lame duck session, you're not gonna believe what they're gonna try to stick on the wall. But it's gonna affect everybody in this room, I don't care who you are, if they get away with it. You hear a lot of people talk about veterans, how they support veterans. Well, there's people in Washington, when they talk about veterans, they're talking about the Department of Defense military industrial complex, and they're rich buddies that run it. So when somebody says veterans, make sure they talk about people that have served this country, not the industrial complex behind DOD. Even though we've got a lot of union brothers and sisters there, that's not where the money goes. The money goes into contractors' pockets. The next couple of months, you're gonna see a lot of stuff come up about veterans and DOD. And I can tell you for a fact, there's no enemy in the world that can stand up against our military 10 years ago, let alone today. I spent enough time in DC to know that there's nobody out there can hurt us. So just remember that. Just so you'll know, in West Virginia today, we've got over 1,000 homeless veterans. If they go to cutting veterans' budgets, veterans' benefits, that's gonna double real quick. And that is something that nobody in this state.
Ask Gary Zucker, please come up with the Citizen Action Group from West Virginia United.
Thank you, Kenny. There's been a lot of good testimony here today. I'll try to be short and wrap this up, but I'd just like to ask a question. What is a budget? Families have budgets. Nations have budgets. We're getting ready to roll into a big budget fight down in Washington. But a budget is not just a bunch of numbers on a piece of paper. A budget is a moral document. It's where we as a society expose our values, where we put our money is what we value. Social program cuts on a budget are not subtractions on a piece of paper. They're subtractions of the quality of life for seniors, for children, for workers, for families. And that leads me to another question. Who should pay to fix the deficit? Should the high rollers on Wall Street, should 2% pay to fix basically what they broke? Or should the Social Security recipients, the daycare kids, the teachers, the firemen? And I'll tell you that Citizen Action will stand with our labor brothers and sisters, will stand with the social workers, will stand with the faith community, and we will fight any cuts to Social Security, Medicare, Medicaid, any of the social programs. I just want to leave you with one thought, that the best stimulus is a working family with money to spend, with money in their pockets.
That's right.
Thank you.
Finish with this. Wall Street's trying to get the attention of everybody and put their name back on top. I'll tell the politicians, put working people's name back up on top, and this country would be a whole lot better. With that,